Hello, I'm Dr. Vivian Gahtan, and this is a Society for Vascular Surgery briefing on vascular lifestyles. A career in vascular surgery allows choices for achieving balance between personal life and work as a vascular surgeon. The choices made are important to be sustainable, and interests and needs may vary at different times in your life. For some individuals, family and personal interests are paramount. For others, home life fits around career. There are many different work settings: academic, Veterans Administration, private practice, including solo, single specialty group, multidisciplinary group, hospital employee, HMO employee. Although there is some common ground, each of these different work settings holds certain advantages and disadvantages. Within academics, there can be a range of roles that can shape your career. Examples include administrative leadership, research, education leadership, clinical practice emphasis, community outreach. Even within the different work setting choices, there are a number of other options to consider. For example, do you want to be engaged in the training of medical students, general surgery residents, or vascular surgery residents and fellows? Are you interested in engaging in research and scholarly work? Basic science is almost always equated with research. However, most research and scholarly work within vascular surgery is clinically oriented. While most publications come from surgeons in an academic environment, many important publications come from the private sector as well. Clinical trials are conducted in both academic and private practice environments, and this option is not eliminated if choosing private practice. Are there other aspects which you want to focus your practice? For most vascular surgeons do a wide range of procedures requiring the performance of open and endovascular procedures for the treatment of arterial occlusive disease, aneurysmal disease, venous disease, dialysis access, and management of complex wound problems. In contrast, some individuals develop a subspecialty practice within the scope of vascular surgery. In this case, the surgeon focuses their efforts related to an area of interest, specific opportunity, lifestyle, or economics. Some examples include venous, dialysis access, endovascular focus, and complex aortic surgery. The area that has gained increasing attention is having a predominant or exclusive venous practice, particularly in the management of varicose veins. This area reimburses well, and some surgeons use this revenue to supplement their arterial practice. Others enjoy this patient population, like the efficiency of performing a limited number of procedures, find the work pleasant and low stress, and are able to comfortably restrict their work hours to a more elective practice based outside of the hospital. Dialysis access is another area that some vascular surgeons focus their practice. Some even affiliate with a dialysis access center where they perform placement of arteriovenous fistulas, arteriovenous grafts, catheters, and open and endovascular revisions. Most of this work can occur in day hours. Other surgeons focus their practice on endovascular work almost exclusively as a niche within a group of vascular surgeons. Patients undergoing endovascular procedures are largely outpatient or have a short hospital stay. In contrast, relatively few centers do vascular surgeons do a volume of complex aortic work, and if this is the goal, this work requires a different level of support and perhaps training. In conclusion, the discipline of vascular surgery is a satisfying one. There are many choices within the specialty. With making strategic choices in the right setting, achieving balance between your professional and personal life is easily attainable. This briefing is made possible through a grant from Cook Medical. To learn more about careers in vascular surgery, visit vascularweb.org.